Hello listeners, this is Dr. P. Mary Anpuma. In this video, we'll be studying about disorders of lipid metabolism, which is a part of our study of clinical biochemistry. First is hypercholesterolemia. Cholesterol is a fatty substance that occurs naturally in the body. It has several vital functions. It is a part of cell membrane and is the precursor for few hormones. The liver converts fat into cholesterol and releases cholesterol into bloodstream. There are two main types of cholesterol. We have low density lipoproteins cholesterol, the bad cholesterol, and the high density lipoproteins cholesterol, the good cholesterol. High levels of LDL cholesterol are linked to atherosclerosis, which is the accumulation of cholesterol rich fatty deposits in arteries. And this can cause arteries to narrow or become blocked, slowing or stopping blood circulation. The desired levels of LDL cholesterol depends on whether or not a person is already having a disease caused by atherosclerosis or diabetes or other risk factors for coronary artery disease. The risk factors include being a male older than 45, being a female older than 55, being a female with premature menopause, having a family history of premature coronary artery disease, that is a father, brother, younger than 55 with coronary artery disease, or a mother or sister younger than 65 with coronary artery disease, or if a person is smoking, having high blood pressure, or not having enough good cholesterol, that is not having even this HDL, also can pose a risk for this atherosclerosis. Symptoms include about 1 out of 500 every people have this inherited disorder, which is called familial hypercholesterolemia. This causes extremely high cholesterol levels that will be around 300 milligrams per deciliter. Above that, people with disorder can develop nodules too. Next is atherosclerosis. Atherosclerosis occurs when the blood vessels that carry oxygen and nutrients from heart to the rest of your body, that is arteries, become thick and stiff, sometimes restricting blood flow to organs and tissues. Healthy arteries are flexible and elastic, but over time the walls in the arteries can harden, and a condition of this is commonly called as hardening of the arteries. Atherosclerosis is a slow progressive disease that may begin as early as childhood. Atherosclerosis may start with damage or injury to the inner layers of the artery. Here is a representation of atherosclerosis. This is the normal artery wherein the artery wall is free, allowing the blood to flow. While this is narrowing of artery because of deposition of these plaques, here is the narrowed passage, and this is the plaque representation in the case of atherosclerosis. Damage to artery, this may be caused by high blood pressure, high cholesterol, high triglycerides, a type of fat in the blood, then smoking or other causes, sources like tobacco, insulin resistance, obesity or diabetes, inflammation from diseases such as arthritis, lupus, or infections or inflammations of unknown cause. Once the inner wall of an artery is damaged, the blood cells and other substances, they often form the clump at the injured site, and they build up in the inner lining of the artery. The risk factors associated with this are hardening of the arteries. They occur over time. Besides aging, factors that increase the risk of atherosclerosis include high BP, high cholesterol, diabetes, obesity, smoking, and familial history of heart diseases, lack of exercise, and even unhealthy diet. Complications, these depend on which arteries are blocked. Say for example, we have coronary heart disease. This narrows the arteries close to heart, which can cause chest pain, that is angina, a heart attack, or heart failure. Next, we have carotid artery disease. When atherosclerosis narrows the arteries close to the brain, it leads to carotid artery disease. Then we have peripheral artery disease. When atherosclerosis narrows the arteries of arms and legs, leading to circulatory problems in the arms and legs, this is called as peripheral artery disease. This leads to sensitivity to heat and cold, increases risk of burns or frostbite, and in rare cases poor circulation in arms or legs can even cause tissue death, that is gangrenes are seen. Aneurysms. Atherosclerosis can also cause bulge in the wall of artery causing pain in that area. If an aneurysm bursts, it can be life-threatening due to internal bleeding. Chronic kidney disease. Atherosclerosis can cause narrow of arteries of kidney preventing oxygenated blood flow. Over time, this can affect kidney functions leading to kidney failure. Prevention is healthy lifestyle is recommended. So some healthy lifestyle changes can be recommended to treat atherosclerosis to prevent it, and these include quitting smoking, eating healthy food, exercising regularly, and maintaining healthy weight. Thank you for watching this video. See you in our next video.